The mouth speaks when the mind endures. Bridging the gap between mental and oral care is no longer optional. A warm welcome and assalamu alaikum to all of you. My name is Fiza Batool and I'm a third year dental student at Ziauddin University. I chose to shed light on this topic on an often overlooked connection, the link between mental and oral health, particularly through the lens of eating disorders. I'm sure we all know patients who are diagnosed with a mental condition or an eating disorder, or maybe both. But did anyone ever think to bridge the gap? Oral cavity is a magical hub. It controls your cardiovascular system, the renal system, enteric nervous system, endocrine system, immune system, nervous system, so on and so forth. So we must understand that what our elders used to say is 100% true. You are what you eat because the food you consume has a psychological impact and your oral cavity bears witness to it. So this is exactly what has been explained in these three bullets, that nutrition can either fuel a body or a mind or it can erode both of them. And here's a scenario that every smiling patient at the clinic may conceal some sort of stress and anxiety, and eating disorders bridges both of them. Now we establish that the link between mental health and oral health, the complication that could cause in the oral cavity. Now we study the eating disorders themselves. What is it exactly? And just a disclaimer, this is a picture of me and my friends. We reenacted these pictures for educational purposes only. Now we have targeted bulimia nervosa, which is episodes of frequent eating and then purging it out or vomiting due to and performing excessive exercise in the fear of weight gain. There's prevalence, etiology, and prevention and treatment written. Then there's binge eating, which is the most common type in Pakistan, where there are frequent episodes of consuming large unhealthy amounts of food without purging behavior, without feeling the need to puke it out. Then there's anorexia nervosa, which is a complete withdrawal of food leading to extremely dangerously low body weight. And then avoidant restrictive food intake, which is withdrawal from certain foods, not specifically all kinds of food, in the fear of weight gain. The most archaic biomedical concept in dentistry states that a human body is like a machine. If any part of it is broken, it must be fixed by a healthcare professional. So we must understand that whatever disease a body sustains, it has impacts and it could cause lifelong complications if not intervened timely. So this is the answer to why eating disorders matter, or even if it bridges the gap between mental health and oral health, this is why it is important. It could cause lifelong complications. It could lead to psychological impact. There could be early oral signs and the dentist's role to intervene it, because we can clearly see it causes xerostomia, there are dental caries, halitosis, dental erosions, and it could cause pedial diseases. Previously, we discussed what could happen to the oral cavity if the eating disorders persist. Now we're going to understand the mechanism. So, a tooth is surrounded by enamel, which is the hardest calcified tissue in the human body. Now, if there's constant acid exposure to it, it would obviously cause the enamel to dissolve, which is seen in bulimia nervosa and binge eating. Then there's sugar dysregulation, because if you're constantly consuming sugar and you're not taking appropriate measures to prevent it, it could definitely lead to caries progression. And then finally, there's nutritional deficiency witnessed in anorexia nervosa and avoidant restrictive food intake, which causes impaired saliva, healing, and immunity. Here's a pictorial representation of whatever we have studied until now. I like to call it the vicious cycle. So, if a person is suffering from halitosis, first of all, the person himself would know he is suffering from halitosis, and people around him would not miss a chance to let him know that his breath stinks. That would lead to mental health problems, because obviously, any remark made about oral health or oral practices in general leaves a stain in your mind. That would lead to faulty eating habits, unhealthy coping mechanisms that was cause damage to the oral cavity, and again it could lead to reduced self-confidence, and the cycle continues. We created the link, highlighted the problem, studied the side effects. Now we must take concrete steps to eliminate the problem, or in one word, prevention, because the cycle itself is a loophole. Okay, so frequent sipping of water for patients who have xerostomia, oral hygiene maintenance, consume healthy diet, rinse after having acidic food, sugar-free chewing gums, our dear old friend a mouthwash, regular dental checkups, and avoiding sugary foods, alcohol, and tobacco products. In an ideal case scenario, a person who has been diagnosed with an eating disorder would be taking preventive measures and the situation itself would not aggravate to treatment. However, in third world countries like Pakistan, they do not recognize eating disorders as a mental illness. They think it's a lifestyle choice and they make derogatory remarks about somebody who's eating too much and calling them an elephant, or insensitive remarks about a person who's not eating at all and calling them a matchstick. So it's important as dentists that we play a pivotal role as healthcare professionals to diagnose and refer further treatment. A patient with fear, agony, and embarrassment, nothing new for the dentist to deal with. It's a silent crisis. There are invisible battles, stigma, and oral health that reveals the truth. 2025 is about to end. It's important that we talk about eating disorders because that is the only way they become important. And it's important to evolve with times and combat such illnesses from scratch. In conclusion, eating disorders are more than just psychological struggles. They have visible, measurable, and damaging effects on oral health. As future dentists, recognizing these signs early gives us the opportunity to intervene, refer, and provide compassionate care that goes beyond the mouth. Let's remember every smile we protect could be someone's silent cry for help. Thank you.